Hi, today's topic is enteroviruses. So, for this, what is enteroviruses is another kind of virus, which is RNA virus, and it's single-stranded RNA virus. Mostly the RNA viruses are single-stranded, associated with several human and mammalian diseases. And what kind of diseases? They are related to the that means enteric diseases, that means for digestive intestine. So enteroviruses are named by their transmission route through intestine. So they infect, these viruses infect the intestine or our alimentary system. What are the characteristic features of it? They are under the genus Picornavirus family, and then their main uh, region of replication is mainly the gut, human gut. Single-stranded naked RNA virus with iso heteral symmetry. That means they are symmetrical, isometrical. Unlike rhinovirus, they are stable in acidic pH. So they are not in basic pH stable virus. They are in acidic pH virus. Capsid has 16 copies of each protein, and with various proteins they are arranged in isohedral symmetry. And they are like these are their characteristic features. At least 71 serotypes, varieties of these enteroviruses are available, in which polioviruses, they are very common for this causing polio. Coxsackie viruses, Coxsackie B viruses, echoviruses, and enteroviruses. So enteroviruses is the main concerned virus on which this topic is associated, and they are mainly responsible for infecting our guts. What are various categories of enteroviruses are there? One is polioviruses. Just now I have told polioviruses. They are available in three serotypes or three types. Their main features are asymptomatic infection. They are responsible for causing asymptomatic infections, viral meningitis, paralytic diseases, and poliomyelitis. Poliomyelitis is very common because that causes polio in our childhood. Coxsackie A viruses, there are 23 types of serotypes of viruses available. They are responsible for viral meningitis, body rash, and various other symptoms. What are B viruses? Coxsackie B viruses. There are six types, B1 to B6. They are nothing but the serotypes, and they are also responsible for mainly meningitis. Okay, and echoviruses are various types, broadly classified into 32 types of serotypes. Viral meningitis with orchitis, that means pain creating uh, in the intestine. Other enteroviruses are four types, 68 to 71 viral meningitis. Their transmissions are through fecal route, that means either by oral route, poor hygiene condition, dirty diapers, etc. during childhood, ingestion via contaminated food and water, contact with infected hands, inhalation of infectious aerosols. Okay. Pathogenesis of enteroviruses, various routes or channels through which this infection comes into our system. That is, intestine is affected by this system. So this is the pathogenic pathway by which this virus comes inside our body, and then it will eliminate it and transmit. It has been transmitted. Rhino, echo, Coxsackie, and polio. So these are the primary four types of echoviruses or ectoviruses. They are primary, secondary, and different types. Main tissues are skin, muscles, brain. That's why meninges and liver. Next is polio. The main concern virus of enterovirus is poliovirus. Poliovirus is the causative agent of poliomyelitis in human enterovirus, and number of family of they are under the family of Picornaviridae. RNA virus single-stranded. Just now I have told the single-stranded positive sense RNA virus, which has nucleotide of 7,500 nucleotides long. Length is too big. The viral particles have 300 angstrom in diameter, and they have isohedral symmetry. That means symmetrical body with isohedral pattern. Pathology and pathogenesis, just now I have told the way it has been transmitted throughout the body. Next, the nature of the disease: muscles weakened, polio, shoulder muscles, and this structure of foot, etc. These are the typical feature of poliomyelitis virus infection. Oral polio vaccine is the only way by which, that is also called SEVINS. So that is the only way by which we can prevent these various serotypes of polioviruses. Okay. Next is pulse polio immunization is the only way by which we can eradicate this polio, and it has been accepted throughout the world. So nowadays poliovirus infection is much more reduced because of this measure. Diseases associated with this coccessive B virus. Coccessive virus are two types, A and B. Coccessive B virus, they are febrile illness with musculopapular rash. So body rash is a common symptom. Upper respiratory tract infection is very painful. Upper respiratory tract infection, paralytic diseases, meningitis, encephalitis, and myocarditis, juvenile diabetes, and pancreatitis. So these are that means coccivirus. This virus is the causative agent of all such symptoms. The structure of this slide shows the various schematic diagram of various structures of enterovirus particles. Suspected diseases, like they have been speculated by type 1, they are responsible for type 1 diabetes. If you are infected with this kind of virus, then you are very prone to type 1 type of diabetes. And these viruses may be a cause of myelitic encephalomyelitis or chronic fatigue syndrome. So that's why it is called CFS. Symptoms: most people who contract this enterovirus have mild symptoms lasting about a week. So it's not very long duration disease, but 1 week duration of this infection occurs. So those with high risk may have more complications, sometimes become fatal. So viral infection, RNA virus infection, obviously, if it has been neglected for certain period of time, then it would be very fatal. What are the treatment procedures? Treatments are mainly supportive. So there is, since virus, that means vaccine is the only way by which we can prevent the infection. In case of pleurodynia, treatment consists of analgesic to relieve the several pains. So because it's a painful disease, so pain relieving factors are the main treatment for this viral infection. Okay. In patients with enteroviral carditis, treatment consists of prevention, treatment of complications such as arrhythmias, pericardial effusion, and cardiac failure. So these, if it is not been taken care of, then these are the various results we can get it. So that's all about enteroviruses. Thank you.